All right. So in your facilities, one thing that you want to remember is that as the QMAP, a lot of times you are more of like the shift leader. You're the main person in charge per se. So you want to remember for emergency situations what to do. So one of the biggest things to always remember is to stay calm, right? Because whenever something's going on, everybody's going to react the way that you're reacting. So if you're calm, you're taking order, you're having people respond, people are going to respond that way to you, right? So you want to make sure that you're either yourself calling for whatever help you need, whether that's right here in person or actually getting on the phone. Maybe you all have a protocol that you call your supervisor first. Maybe it is 911 first, depending on the situation. I always usually say if there's blood, especially coming from your head, call 911. That's usually a good thing. If you see maybe appendages that are not in the right anatomical position, that means like an arm's bending the wrong way or a leg's bending the wrong way, 911, right? You want to make sure you're getting the right response here first. And you want to make sure that you know your limits within a situation, that you're able to look at a situation, gather the information that you have, but then you're reporting it off. So you're not making an assessment and making any changes or implementing any changes. As a QMAP, all you can do is take in what you see and report it off to somebody else. And then that is where they are going to give you the direction of what to do. Specifically, a lot of times you're going to be reporting to a nurse, because a lot of times your situations may be clinical. Especially when you're coming to a medicational situation, you can never give a medication without an order. So again, in a situation if somebody's telling you to give a medication and it's not something you have an order for, it's not something that you typically are giving, you want to make sure that you have a nurse on hand that is helping you with that, or until EMS gets here to take over that situation. You never want to move anybody that's injured, especially in a situation where somebody's fallen or something like that. You want to reassure that person and keep them comfortable as well. Again, making sure that you're calling for direction. If it is an anaphylactic, which means like an allergic reaction situation, if you have EpiPens for any of your residents, you want to make sure that you know that, and you want to be able to know whether they're able to give them themselves or not. I know in some residential situations like this, that can change, and depending on the needs of the resident, you have to change for that. But as a QMAP, you are not able to administer epinephrine, and that's usually where you do it in their thigh and you hold it. Typically what you do as a QMAP is you want to hand it to that person and you instruct them and help them to self-administer that medication. So that is not one that you're actually covered under the QMAP to administer, but if you're being delegated over 911 or from a nurse to do that, you can do a self-administration for that. For emergency situations. The other thing for emergency situations is, again, you always want to remember what your resources are. Who do you call? What are your protocols? Who do you need to get in contact with? If the basement's flooding and there's something like that happening, you probably don't need to call 911, but you probably need to call your supervisor first, call the, maybe the water company. There's probably different protocols depending on what the situation is. You always want to make sure for a resource that there's a drug book handy, or you all know what the proper resources are to pull up a drug book, which is, it's basically like a dictionary, a pharmaceutical dictionary that has all the medications, their generic names, their trade names, the indications for use, contraindications, side effects, a lot of information about that. So you don't anymore have to have the physical book, but again, you have to have the knowledge of knowing where to go online, because you can't just Google. That's not technically an approved resource, but knowing to go to the actual drug handbook websites and using their apps or using the official information anytime you need to look up a medication, or anytime there's a question about a medication too, there's always going to be on the label from the pharmacy a number. Typically there is a 24-hour answering pharmacist that you can call and ask questions. If you ever have a question about a medication, or maybe it's a new order for somebody and you're like, man, this just doesn't seem right, never go away from your gut feeling, and always call somebody. Always ask questions. That is your job as a QMAP, to just ask a lot of questions. Again, report what's going on. You are the eyes and ears for your residents and your patients, and making sure that they are safe, making sure that they have what they need, and making sure that their environment and their conditions that they're in is safe for them and also safe for you. So that is the main part of this class, is just really making sure, you know, that we're handling situations properly and that we're keeping you and your residents safe. Awesome.